acupuncture is one of those things in the Chinese medicine field. It's based on balancing the vital force and promoting circulation of blood so that the body can heal itself. So basically, we feel that the body has the power to heal itself. Does anyone else think that that's true? The body heals itself? Yeah. You cut yourself and it should close up. It should heal. Sometimes if there's dirt and other stuff, you have to get the dirt out of the way. If there's bullets or something, you have to get the bullet out if you can. But then the body should heal itself, and that's the basic principle of natural medicine, that the body has the power to heal itself. And in Western medicine too, same thing. I mean, doctors are not going to say the body doesn't know how to heal itself, because doctors do not know how to do what the body can do. We're learning more and more over time, but there are various schools of thought, and there's 35 centuries of development and spreading throughout the world. It started in China, and then it spread to other parts of the world. Anyone heard of the Shogun era in Japan? Well, in Japan, the Shogun was a period right before Japan, and I read, write, and speak Japanese too. I studied there as well. So, in Japan, and the Shogun had created acupuncture vocational schools for the blind. So I don't think CIL has a program on acupuncture for blind people here. But so in Japan, many of the things that are used in Japan, the development of acupuncture Japanese style, is different from Chinese style because it was developed for people who are blind. And it came out of the technology of the blind. So it's sort of like CIL, whereas the disabled actually knowing most about how to help other disabled people. Well, the blind knew how to figure out how to do blind acupuncture better than anyone else could. So they developed a lot of things related to that in Japan. So Japanese style acupuncture is a little different from Chinese style. So there are a lot of different kinds of licenses that if you go into an office you might see. I was licensed in 1983 in California. This is the old style of license. This is what the new style looks like. So it's changed over the years. Initially, acupuncturists were, in 1976, acupuncturists had to practice on referral from an MD. And then about 1980, well, I'm not sure exactly, 79 or 80, it became that acupuncturists were primary healthcare providers, meaning we don't have to have a referral from an MD to see people in our office. Chiropractors are the same way. Naturopathic doctors are the same way. Nurses, no. You have to have a referral from a doctor for a nurse to see you. Physical therapist, no. You have to have a referral from a doctor to go to a physical therapist. A physical therapist can't see you directly without a referral. Yeah.
When you say nurses, nurse practitioners can be primary care providers, correct?
I don't know if they can have their own office. I think they have to be in an office with an MD, but I'm not positive. I'm not positive. It's a good question.
I got a question.
Yeah.
On the licensure.
Sure.
What's the prerequisites for licensure?
Like all of the different, like acupuncture, chiropractic, naturopathic, there are requirements, there are academic requirements that have to be met before you sit for a licensing examination. And the state of California has licensing exams for acupuncturists, not for naturopaths, and for chiropractors, it's a little different. I'll talk about that in a moment. But for acupuncture, there's acupuncture schools now that you go to, and then when you graduate from there, then you can sit to pass the qualifying exam. There's also national certification. Like in the United States, there are 44 states that license acupuncture. When I first started, in 1983, there were 5. So over the course of the last 30 years, there have been 39 more states that actually license it. So there is a national certification program that someone might also have done. It's not required to practice in California, but in other states it's required. Now, when the national certification came out, I went ahead and did it just in case I needed it for other places. That was in 1985, the first exam. So, except these two are now red states. I mean, this is called red state, blue states. It doesn't have to do with politics. It just has to do with where acupuncture is. So Louisiana and Mississippi have licensure based on the national exam. California is the only state that doesn't allow it. Just like in certain states, like the bar exam. If you go, some states you pass it in one state and it's reciprocal. California, I don't think is that case, and I think New York isn't. You have to actually do the licensing in those locations. So it's almost nationwide. There's also diplomas, there's master's degrees, there's higher levels of degrees. Now in California, the entry level for licensed acupuncturist is a master's degree, but there's also a doctorate degree that's available too. And so I have a doctorate degree from many years ago. In California, there's also the workers' compensation system. And acupuncturists are physicians. We are physicians, actually. That word is used for acupuncturists as a physician in the workers' compensation system. Just like psychotherapists are physicians in the workers' compensation system. And MDs also, too. If someone gets injured, anyone ever had a work injury? You don't have to say, but you could. Had a work injury. If you go through that whole process, and I think I alluded to it before as far as disabilities and impairment, and if you have an injury on the job and you get treatment and you get back to your pre-injury status, everything's fine, nothing else happens. If you get injured, but the medical profession, acupuncturists, chiropractors, MDs, surgeons, can't get you back together again, like Humpty Dumpty fell off the wall. You can't quite get the shell totally back together. Then a person is compensated for the difference between their ability to do what they used to do and what they can now. And so you get a disability rating, and you get rated, and you get money based on the amount of disability you have. So that's this whole other arena of the use of the word disability compared to what we were talking about before. So I'm a qualified medical evaluator, which means that I'm able to evaluate people based on overall, at the end of all their treatments done, whether or not they are disabled or not in the work